Hello, my name is Dr. Dewan S. Raja. Today I will discuss about vaccine-associated neurologic diseases. Vaccine-associated neurologic disease refers to neurological conditions or disorders that may occur following vaccination. These conditions are relatively rare but can include various manifestations such as meningoencephalitis, inflammation of the meninges like that of the pia mater, dura mater, arachnoid mater, and also the brain, Guillain-Barré syndrome, and ascending paralysis, demyelination of the peripheral nervous system, acute disseminated encephalomyelitis, entire brain is disseminated with some infective foci, transverse myelitis, usually affecting the spinal cord, cranial nerve palsy, any cranial nerve, maybe oculomotor nerve, facial nerve, abducent nerve, vaccine-associated viscerotropic disease, not only brain, other viscera may be affected like kidney, liver. Commonly, vaccine may not cause serious neurologic diseases. If it happens, that is very rare. Okay, but most commonly we'll get complaint like headache, reaction at the site of vaccine, irritation, there may be fever, but these are serious issues like meningoencephalitis, Guillain-Barré syndrome or GB syndrome, acute disseminated encephalomyelitis, transverse myelitis, cranial nerve pulses, vaccine associated with viscerotropic diseases, that is, we may also include brain itself is a viscera. Other than brain, we might have other organ like that of the kidney, liver, heart, lung may be affected. Okay. Guillain-Barré syndrome is perhaps the most well-known of this condition. But remember that Guillain-Barré syndrome is ascending paralysis condition with demyelination of the peripheral nervous system. One of the cause of Guillain-Barré syndrome may be vaccine associated, but this is also rare. Guillain-Barré syndrome may be caused by many other reasons like that of the food poisoning like Campylobacter jejuni. Even it may be a complication of some type of diarrhea like rotavirus. So this is an autoimmune disorder where the immune system attacks peripheral nervous system, particularly the myelin of the peripheral nervous system, leading to muscle weakness and ascending paralysis, and it may damage the diaphragm and may cause respiratory failure. But the good news is that this is manageable in the hospital, and if it is managed, usually that is a total management and total recovery from Guillain-Barré syndrome. Exact cause is not always clear. It's been observed that GBS, that is Guillain-Barré syndrome, can sometimes occur after certain vaccination, particularly influenza vaccine. It may be other vaccine like that of the DPT vaccine. Okay. And some of the scientists also suspecting COVID-19 vaccine associated with not only the Guillain-Barré syndrome, also other neurological complication may happen rarely along with COVID-19 vaccine. Acute disseminated encephalomyelitis is another neurological condition characterized by inflammation of the brain and spinal cord, mostly brain. It often follows viral infection or vaccination may be a complication of measles vaccine or measles disease. Symptoms can include fever, headache, seizure, and neurological condition, and this is ADEM, acute disseminated encephalomyelitis, is a fatal condition. Transverse myelitis, another neurological problem, is the inflammation of the spinal cord leading to weakness, sensory disturbances, and sometimes paralysis below the affected area. Okay, so we got multiple neurological complications like that of the Guillain-Barré syndrome, ADEM, transverse myelitis. We may also problem in other viscerotropic problem, that is also possible. But we have some precaution to declare that vaccines are associated with neurological diseases. This happens rarely, not always. It is important to note that while this condition can occur following vaccination, the risk is generally very, very low. The benefits of vaccination in preventing serious diseases usually outweigh the risk of these rare adverse events. Additionally, vaccines undergo rigorous testing for safety before being approved for public use, and monitoring systems are in the place to detect any rare adverse events that may occur after vaccination. If that happens, then both the physician as well as the patient may complain to the vaccine authority, vaccine associated disease authority. And that's all about the vaccine related neurological disorders or diseases. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.